Good morning, students. In preview of the obstetrical and midwifery nursing, that is the physiology and management of the normal puerperium. In that, we included that the definition of the normal puerperium, okay, given by the different obstetrician. Then, what are the stages of the puerperium? We already learned that the in which organ of the reproductive tract are revert back into pre-pregnant state, both anatomical and physiological. Okay, so we learned all these things in previous lecture. Now further move on, we will learn about the lochia. So what is the lochia? Lochia is the uterine discharge that occurs after the birth. Okay. So in first few weeks, the uterine discharge after the delivery of the birth baby is known as a lochia. Lochia is initially bright red, changing later to a pinkish red or reddish brown color. Okay. So it has color of the bright red, changing later on pinkish or red or reddish brown. For the first 2 hours after the birth, the amount of lochia should be about that of a heavy menstruation period. After that time of lochial flow should steadily decrease. So, in first 2 hours after the birth, the amount of the lochia is very high. That is due to the heavy menstrual period, and the flow of lochia should be steadily decreased gradually. And lochia has a mainly three stages, that is lochia rubra, lochia serosa and lochia alba. Lochia rubra consists of the blood, decidual and trophoblastic debris, and it lasts for 3 to 4 days after the childbirth. Okay, so first type of the lochia is the lochia rubra. It has a bright red color and it lasts for 3 to 4 days after childbirth, and it consists of the blood, residue and trophoblastic debris. Okay. Second one is the lochia serosa. It consists of the old blood, serum, leukocytes and tissue debris. The flow becomes the pink or brown, and it lasts for the 3 to 10 days after in postpartum period. This is the lochia serosa, which expel for the 3 to 10 days after in puerperium period. Last one is a lochia alba. It consists of the leukosa, decidua, epithelial cells, mucus and bacteria. It has color the yellow to white in color, okay, pale yellow to white color. And lochia alba may continue to drain for up to beyond 6 weeks after the childbirth. Means in whole postnatal period or puerperium period, lochia alba may continue till the 6 weeks, okay, after the childbirth. So the amount of the lochia is usually increased with the ambulation and breastfeeding. Okay, the lochia is continuously low due to the heavy menstruation and also breastfeeding and lactating mother. Okay, persistence of the lochia rubra early in the postpartum period suggests the continued bleeding as a result of the retained fragment of the placenta and the membranes. Okay, so lochia rubra early in the postpartum period and also suggests heavy bleeding as a result of the retained fragment and placental beads or membranes. The another common surface of the vaginal bleeding is vaginal or cervical laceration, means tear formation into the internal organ of the woman. This may cause due to the vaginal bleeding or tear into the vagina in a cervix. Next one is a lochial bleeding and non-lochial bleeding. Okay, so how lochial bleeding occurs and show. So lochial usually trickles from the vaginal opening and steadily flow is a greater as the uterus contract. When uterus contract, the lochial bleeding is a steadily flow from the vagina, and the non-lochial bleeding is a bloody discharge spurts from the vagina. Okay, and a gush of lochia may result as the uterus is massaged in lochial bleeding. We can find out the by uterine massage, gush of lochia may result into the in the vaginal tract, and the amount of bleeding continues to be excessive and bright red in a non-lochial bleeding. Okay. Okay, so after the lochial and lochial bleeding, further move on, we will about the after pain. How pain is occur in the postnatal mother. So after expulsion of the fetus and placenta, the uterus contracts and regain its normal size as we saw earlier. Okay, and in weight size, this is called the involution process of the uterus. We know that. And the oxytocin is released from posteriorly lobe of the pituitary gland in response to the sucking, which facilitate uterine contraction. So here the main action of the oxytocin is releasing from the posterior lobe of the pituitary gland and in response for the responsible for the sucking and which facilitate the uterine contraction also. So the oxytocin may help into the breastfeeding to a mother to baby and also facilitate the uterine contraction. Okay. So due to that mother having feeling of the pain. So characteristic of after pain is occur during first 2 to 3 days of the puerperium. So the pain feeling by mother in first 2 to 3 days of the puerperium. Then abdominal pain, cramps and back pain feel by the mother. Strong, how the intensity of the pain, strong, regular and coordinated pain. Okay. So the intensity, frequency and regularity of the contraction decrease after the first postpartum day. Obviously, by day now women enter into the postpartum period. So the contraction, uterine contraction and the action of the oxytocin is day by day decreasing. So the contraction and pain is decreased and feel low by the mother. So primigravida uterus chronically contracted unless the clots or tissue remains in the uterus and the multipara uterus contracts and relax at interval causing the afterpain. So in primigravida mother contracted of the uterus and clots are remain into the uterus, but in multipara woman contraction and relaxation at the interval causing due to the afterpain. Okay, more severe when breastfeeding in both primipara and the multipara. So this is about the afterpain. Next one is a constipation. So it is the common problem of the woman. So it is common in the first few days of the puerperium due to the many factors like the food intake of the mother, interruption in the taking food, or maybe dehydration during labor, abdominal muscles cramps, and perineal laceration may problem into the defecation. Means defecation means voiding in the urine and passing of the stools. So it may be painful for the mother. Okay, so due to that many reasons constipation is occurs into the mother. Next one is the cervix. So how changes occurs into the cervix? So it feels soft immediately after the birth of the baby because in pregnancy phase the cervix and uterus feels firm, but after the delivery of the birth of the baby it becomes soft immediately, and the cervix up to the lower uterine segment and remain the edematous and thin for the several days after the birth. Means it feels edematous into the uterine segment. Edematous means slightly swelling is present into the cervix and thin for the several days after the birth. After the birth of baby, it feels thin. Okay. So the cervical os, which is facilitated to 10 centimeter during labor, close the gradually. It may still possible to introduce two fingers into the cervical os of for the first 4 to 6 postpartum days. Okay. So cervical os is 10 centimeter. While when during labor process and gradually it may still possible to introduce the two finger into the cervical os for the first 4 to 6 postpartum day. These two fingers means we can find out the progress of the labor and how the cervical os and vagina is descending. Okay, so this is main important, and the external cervical os never regain its pregnancy appearance. It is no longer shaped like fish mouth. Yes, this is the most important point you have to remember. because in postpartum period or postpartum period, whole reproductive organ and all organs are become revert back into that non-pregnant state or pre-pregnant state, but the only one organ or one portion of the cervix is not regained into the pre-pregnant state, that is the external cervical os never regain into the pre-pregnant state. Okay, so it returns to its normal state at 4 weeks after the birth, but it tried to become into the normal stage, not fully but partially. Portion are revert back, like after the 4 weeks of the delivery of the baby. Okay. Next one is a vagina and perineum. The greatly distended smooth wall of the vagina gradually returns to its pregnancy size by 6 to 10 weeks after the childbirth, and the mucosa remain atrophic in lactating woman and at least until the menstruation begins again. So the vaginal wall become distended and smooth wall gradually return to its pre-pregnancy size by 6 to 10 weeks after the childbirth. Then the thickening of the vaginal mucosa occurs with the return of the ovarian function. So it becomes in a pre-pregnant state by the returning of the ovarian function. Next one is the reduced estrogen level, also responsible for the causing of the decreased amount of the vaginal lubrication, so that the localized dryness and dyspareunia may persist until the ovarian function returns and menstruation resumes. Yes, the main action of the estrogen and progesterone works here. So the reduced level of the estrogen level also responsible for the decreased amount of the vaginal lubrication and dryness and dyspareunia means pain during the voiding. Okay, so it may feel by the mother and menstruation will be resumed. Okay, so initially the introitus and become erythematous means swelling, and especially in the area of the episiotomy or laceration, because in the area or site of the episiotomy there might be a chances of the wound and infection is there. So due to that laceration and episiotomy there, the woman may have infection in that area. So it have to it has to be repaired by the and proper care by the midwife nurse. Okay. Next one is a if episiotomy and laceration have been carefully repaired, then hematomas are prevented or treated earlier. As I told earlier that due to the episiotomy, incision and laceration, woman may have chances of the infection. So if this repair is not done, so chances of the hematoma are there and prevented. If hematoma occurs, then midwife have to be careful for the mother and preventive measures apply and treated it initially. Usually healing should occur within 2 to 3 weeks, and hemorrhoids usually decrease in size within the 6 weeks of the childbirth. Okay. Then pelvic muscular support, because in the while delivering of the baby, the way of the pelvic is become very wider. So if not supporting area is there or not support is given into the pelvic area, the chances of the internal injury or into the pelvis is occur. Okay, so the supporting structure of the uterus and vagina may be injured during the childbirth, and the supportive tissue of the pelvic floor that are torn or stretched during the childbirth. It may require up to the 6 months of to regain the tone. Yes, because if injuries to the pelvis or internal organ pelvic floor is occur, then it may time that 6 months to regain for the repairing of the tone. So women are encouraged to do Kegel exercise after the birth to strengthen the perineal muscles and promoting the healing. Okay. Then perineum. Swelling completely gone within the 1 to 2 weeks, and the muscle tone may or may not return into the normal depending on the extent of the injury. Because if injury is more, then it takes more time for the healing process. Okay, so in the perineum area, the muscle tones may or may not return into the normal state. Then the muscular wall of the pelvic organ. So the voluntary muscles of the pelvic floor and pelvic support gradually regain that tone during the puerperium period, as I told earlier. Because if a support of the pelvic floor is done and tissue is proper, then the repairing of the tone is easy. But if internal injury is small, then it takes time more than 6 months also. Okay, and not repair as a pre-pregnant state. So tearing or overstretching of the muscular or fascia at the time of delivery, then predisposed to genital hernia may occur, and the overdistension of the abdominal wall during pregnancy may result into the rupture of the elastic fibers. Hernia means the protrusion of any organ. So in abdominal wall or over distension of the abdominal wall may occur during the pregnancy. So, involution of the abdominal musculature may require 6 to 7 weeks of the vigorous exercise are not recommended until after that time. So, in that case, if involution process is failure, means subinvolution takes place. In that case, we suggest to stop any vigorous exercise by the woman till 6 to 7th weeks. Okay, next. Okay, so next is the anatomy of the breast. So in the structure of the breast, that is in figure, it marks by different alphabetical. So A is denote that the duct, B for the lobus, C for the dilated section of the duct holding that holding the milk. Then D is the nipple. This part, okay, that is nipple. E consists of the fat. Then F pectoralis major muscles, and G for the chest wall or rib cage, and enlargement also done by that. So abnormal, a normal duct cell, B basement and in this figure, A stand for the normal duct cell, B for the basement membrane, and C for the lumen, means center of the duct. Okay, so this is the structure of the breast, and in next session we will learn about the physiology of the lactation. So how baby can suck the breast milk of the mother. So if you have any doubt, then you may ask in the next session. Thank you.